Our next topic is fibrinolytics or thrombolytics. So, from the name itself, it is clear. Fibrin, it what forms the clot. So, fibrinolytic means which lyses the clot or which breaks the fibrin. Thrombolytic. Thrombus is another term which is used for the clot which is formed within the blood vessels. So thrombolytic means which lyses the thrombus or dissolve the thrombus or the blood clot within the blood vessel. So fibrinolytics are those drugs which lyses the thrombi and recanalize the occluded blood vessel. The meaning is when there is a thrombus, when there is a clot within the blood vessel, it will occlude or block the blood vessel. So when the fibrinolytic or the thrombolytic drugs are given, they will dissolve the thrombus and again reopen the blocked blood vessel, that is the occluded blood vessel. And the main use of such drug is used to treat acute myocardial infarction and also for stroke. So you can see this figure. This is a normal epicardial blood vessel. You can see here a normal epicardial blood vessel. And when there is a block, you can see there is a thrombus. And there will be an ischemia in the area supplied by that blood vessel. So when the fibrinolytic drug is given, it will dissolve that clot and it will recanalize that blood vessel and the ischemia is resolved. The drug classification is very simple. Only few drugs. The first drug is streptokinase, the initially developed drug, followed by urokinase, and the latest recombinant human tissue plasminogen activator. I repeat, recombinant human tissue plasminogen activator. Example, alteplase, ereteplase, and tenecteplase. Can note down the classification. I'll give the time. Streptokinase, urokinase, recombinant human tissue plasminogen activator. Example, alteplase, ereteplase, and tenecteplase. So if you see this, you can see that there is a thrombus which is present within the blood vessel. You can see the plasminogen which is an inactive form. And in our body there is the endogenous tissue plasminogen activator is available which can bind to the plasminogen which is bound or entrapped in the thrombus and convert it into the plasmin. And the plasmin can dissolve the thrombus and recanalize that blood vessel. So the mechanism of drug action is also similar. The plasminogen, which may be either fibrin bound or free, it can be converted to plasmin, that is active form by the tissue plasminogen activator, and the plasmin will convert insoluble fibrin or the clot or what we call the thrombus when it is within the blood vessel to soluble fibrin and lyse the thrombus and recanalize the occluded blood vessel. And the drugs what we use all do the same thing, whether it is streptokinase or urokinase or recombinant tissue plasminogen activator. When these drugs are given, they also convert the plasminogen to plasmin and helps in dissolving the clot and recanalize the occluded blood vessels, thus saving a patient with the acute myocardial infarction or even stroke. So note down the mechanism of action is same for all the class of the drugs which are coming under fibrinolytic. So you have to mention only this mechanism of action. This is a mechanism of action which you can mention for all the drugs which are coming under fibrinolytic. So first drug is streptokinase. So as the name tells, it is obtained from strepto. So the strepto stands for streptococci. So it is obtained from beta hemolytic streptococci. Mechanism of action, remember it's the same thing as I mentioned before. It catalyzes the conversion of inactive plasminogen to plasmin, resulting in the lysis of the thrombus and dissolve the clot and recanalize the occluded blood vessel. Remember the flow chart, it will be more easy for you to remember. The disadvantages of streptokinase. As I mentioned, it is obtained from streptococci. So it is obtained from a microorganism. So whatever things obtained from the microorganism, they will be showing antigenicity. So the main problem, it is antigenic in nature. And if there is a anti-streptococcal antibody which is formed in the patient due to any previous infection, it can inactivate the considerable fraction of the dose which is administered at the time of emergency. Because a patient who is coming with myocardial infarction or stroke, it's an emergency situation, we won't get the time to take an history whether the patient had a previous streptococcal infection or not. So if the patient already had a streptococcal infection before, his body might have developed antibodies against the streptococci, and such antibodies can inactivate the drug what we administered, that is streptokinase, and that can result to the failure of treatment. And second, the repeated dose of streptokinase will be less effective because the initially administered streptokinase will develop antibodies, and such antibodies will be present in the blood, and when the second dose which is administered within 6 months will be inactivated by such antibodies. So second dose of streptokinase will be less effective. So the alternative will be usually urokinase or recombinant tissue plasminogen activators. And being antigenic, it can also cause hypersensitivity reactions. So these are the 4 important disadvantages. It is important, remember, it is antigenic. Previous streptococcal infection can develop antibodies, and such antibodies can inactivate the drug, or the repeated administration of streptokinase will be less effective because of the formation of antibodies due to the primary administration of streptokinase. And being antigenic, it can also cause hypersensitivity reaction. And the last disadvantage, it is not specific for the fibrin bound plasminogen. It can activate all the plasminogen, circulating plasminogen to plasmin, which is not required. Actually, what we require is the activation of plasminogen, which is bound only to the fibrin or the clot, so that the clot can be specifically dissolved. Only advantage of this drug is less expensive compared to the other fibrinolytics. Adverse effects, very less. Fever is common, being antigenic. Hypertension and arrhythmia can be also expected. Indication, remember, it is mainly used for acute MI by IV route. In case of acute myocardial infarction, heart attack, what we call, it is given by intravenous route. It can be given for pulmonary embolism, deep vein thrombosis treatment, in stroke patients, which all are due to the clot formation. Intra-arterially, although above 4 uses is by IV route, but it can be given intra-arterially for peripheral vascular diseases. The second drug is urokinase. As the name tells, uro, it is obtained from the urine. Now it is obtained from the cultured kidney cells. The advantage, it is non-antigenic because of human origin. Disadvantage, not specific for the fibrin-bound plasminogen. I repeat, we require only the activation of plasminogen which is bound to the fibrin, but it can activate all the plasminogen which is circulating in the blood. Adverse effect, fever is the main side effect, and it is useful mainly in patients where streptokinase has been already given, because streptokinase second dose will be less effective. In such cases, urokinase can be tried, but it is bit expensive compared to streptokinase. Alteplase, that is the recombinant tissue plasminogen activator. That is tissue plasminogen activator. Tissue means the fibrin bound plasminogen activator. So it is produced by recombinant DNA technology. It is specifically activate the plasminogen which is already bound to the fibrin. That's why it is known as tissue plasminogen activator. It is given as slow IV infusion, and it is a short acting drug. It acts for a short period, so we always require co-administration of heparin so that the re-infract or re-thrombus formation can be prevented. It is non-antigenic. Adverse effects, nausea. There is a mild risk of bleeding because heparin is co-administered, mild hypertension and fever. Retiplase, it is a long-acting drug and it can be given as a bolus dose and it does not require heparin co-administration. That is the main advantage of retiplase. So fibrinolytic, it's a short topic but it is important. It can be asked for 5 mark or 3 mark. Kindly note down. The usual question comes either as fibrinolytic single term. So you have to tell the drug names, explain any one drug. Streptokinase can be asked. The disadvantage of streptokinase is highly important. Rationale question can be asked. Why streptokinase cannot be repeated? Remember, the first dose will develop antibodies, so second dose will be inactivated. So the disadvantages should be noted down. It is important. Thank you. Only this much for the day.